RSV is making headlines, but is the flu also poised now to make a big comeback?
After 2 years of cases being kept largely at bay by the pandemic precautions, experts say several signs are suggesting we're not going to be that lucky this year. So Dr. McGeorge is here with a closer look at what we might expect.
Well, you know, Karen and Jason, as life has returned something closer to normal, we've seen a surge in all sorts of viruses, including the current spike in RSV in children. Now, could that be the case with the flu? Well, we went to the flu lab at the University of Michigan's School of Public Health to find out.
My crystal ball is broken. It's not just cloudy, it's broken.
World-renowned flu expert Dr. Arnold Monto is quick to remind you, flu is notoriously unpredictable. But he says the potential for a big flu season is there.
That's what we're concerned about with flu, because we really haven't had very much flu in the last 3 years.
With fewer people recently exposed to flu, the level of immunity in the community is lower. That may be especially concerning for kids, says Associate Professor of Epidemiology Dr. Emily Martin.
We're watching to see if the fact that we had a few mild flu years or a year where we had no flu at all means that we have kids that have more susceptibility than usual. And they might be at a higher risk than they have been in previous years.
The flu hit early and hard in Australia and other parts of the southern hemisphere. That can be a sign of things to come for us in the northern hemisphere. The dominant strain of flu there was H3N2.
This strain, which we think is going to be the one that predominates this year, is the one that really affects older people and puts them in the hospital and even worse if they're not vaccinated.
Inside the flu lab, researchers track which viruses are making people sick, testing samples from hospitals, doctors' offices, daycares, and households. They also study how effective the flu vaccines are each year. Their data from the outbreak on U of M's campus last year was used to improve the flu vaccine this year.
It's directly related to the vaccine that everybody's getting this year, is based on what we learned in last year's flu outbreak.
Both Monto and Martin worry about flu and COVID spreading at the same time.
There is no reason why we can't see a twindemic.
Monto says one of the biggest threats this flu season is people not getting vaccinated.
We know there is vaccine fatigue, COVID fatigue, and this is something we all have to work to overcome, because it can spill over and has spilled over to the flu vaccine as well.
The flu can be quite severe. I mean, it causes tens of thousands of deaths. It causes tens to hundreds of thousands of hospitalizations, millions of doctors' visits.
With flu, COVID, and a variety of other viruses now spreading,
we just can't become complacent, because you never know who is going to be getting very sick.
As for that flu shot,
now is certainly the time to get it.
Now, Monto also stressed, if you do get sick, it's really important to get tested quickly, especially if you are at higher risk from the flu or COVID, because there are treatments available for both viruses, but the sooner you get them, the more effective they are.
So taking a look at it, what should we be doing and thinking about prevention so we don't get it?
Well, you know, first and foremost, of course, is with the flu in particular, getting the vaccine as well as the updated COVID booster as soon as possible. Both of those would significantly reduce your risk of suffering serious symptoms. It's especially critical if you're a senior or you have any other health problems. But of course, every year we do see some perfectly healthy kids and adults die from the flu, and getting vaccinated dramatically lowers that risk. Now, I would also encourage companies to return to that COVID mindset of keeping sick employees at home. And that goes also for keeping sick kids home from school and daycare as well. As we learned from COVID, it's a very effective way to reduce the spread of viruses.
Very good point.
Very simple, gets to the point.
All right.